hydrochloroquine when the time is right. But if it is not necessary, taking it all the time, perhaps before you take it, can actually give you kidney injury, which might be lying low as if nothing is happening until you become pregnant. It now exposes the underlying renal impairment. Another thing is when a woman have hypertension, more seizure, preeclampsia 3 times in a pregnancy, 4 times in pregnancy, sometimes you advise them don't take it again. Because each of those big hypertension and issue in pregnancy will certainly somehow leave some injury to the kidney. And the more you are injuring them, you are increasing the chances of end-stage renal failure. So in that case, we might say, don't take it again. In fact, we have had an issue when we discussed with that woman. That woman just behaved like Onyocha because she have had up to 3 pregnancies or 4 pregnancies, and there is an injury to the kidney already that is established. We just told her you cannot be able to take it again. Look at this, look at this, look at this. The woman came and said she wants to do family planning. The husband said no. The woman said she must do family planning. Why? Because she have already has an injury to the kidney. Yes, she had 4 kids. And when they were threatening that the marriage might end, she said it is better that the marriage end. They are trying to take care of that. Because Niagawe was on one that the man will still marry another wife. And it makes no sense. I understood her. Until today, we have been following her up, and the renal function has been recovering. She has never for once missed her clinic. Sometimes the clinic, she will miss it if the 4 weeks we give to her money on a Thursday. She will keep calling you. Monday, whether she will continue the drug from Thursday to Monday. Somebody will leave her home for 2 months, come here after 3 months and tell you that but this woman came, we talked about it, she did a family planning. In fact, at the time we are thinking of, do we give injectable or do? The woman suggested that we do bilateral tubal ligation. That one is not reversible. She don't want to take it. She has no male child. She just, most times when you do this bilateral tubal ligation is during surgery. We insisted that the husband has to sign. The husband refused to sign. The woman has to call the elder brother to come and sign. And that was how the bilateral tubal ligation was done. Do you know the most important thing about this story? The marriage has not even destroyed. The marriage is still strong. No male child. I don't know if they finally adopted or so, but the marriage was still. But this man was, Dr. Buchineke, the woman actually escaped death on the last one. And you want her to say, what if she took in again and there is complication and she still deliver a female child? So, but those are one of the ways we say, let us avoid protein in the urine. Usually, avoiding protein in the urine should start many years before pregnancy, because if there is an injury, believe it or not, there is going to be protein. It is not an inherent thing in the pregnancy. It's not something you start preventing in pregnancy when you are pregnant. Another thing is urinary tract infection. You should just try to avoid it. If the urinary tract infection is not there, then protein in the urine will be reduced.